Hello, everybody. Thank you so much. So my talk today is about Mediterranean skin types for peeling. And if we want to talk about Mediterranean people, we have to deal with all these skin types as we see here in these Moroccan faces. And of course, we have so many reasons to suggest peeling because we have many problems. Of course, we have acne scars, atrophic, pigmented, we have lentigo, we have a lack of brightness, we have so many things. And of course, we have melasma, but we have to ensure that we have even a small part or component, epidermal component of our melasma, of course, to suggest peeling. So the problem is that everybody in Morocco, and I think in other part of Mediterranean zone, there is a social pressure for white to have white and bright skins. But we have a higher risk of post-inflammatory pigmentations. We have sunshine days for a long month in the year. We have some aggressive social habit. Hammam, you know it, with the hot, with some scrubbing, with exfoliation, with use of a lot of traditional cosmetic. And moreover, our patient has normally old and usually old lesion with multiple previous aggressive treatment, as we see here in this woman with this pigmented lesion and the redness we can see behind this pigmentation. So that's why most cases need more than superficial peeling and more than one session. And the other problem is that when we see all the type of peeling, all of them has the risk to develop post-inflammatory pigmentation. That's why I would like to talk to you about this article that highlights the importance to have inflammation. Of course, we need inflammation to have our result. We search for it, but we need to control this inflammation. It doesn't need to be too strong, unless otherwise, if we have this inflammation, too high inflammation, we can have a very bad outcome. Some keloids, some very bad scars, and of course, pigmentation, post-inflammatory pigmentations. So that's why we have to move from wait and see attitude to a preventive attitude in order to try to reduce this risk. And from this attitude is to try to have an action on these principal cells that acts in this field of healing, and particularly the mast cells, macrophage, and T cells. And we can see in this image that in this article, the authors tried to prepare the skin with some topics in order to reduce the activity of mast cells. And we see that the activity is reduced when we start the treatment. And more we start it early, more we have inhibition of mast cell activity. Other very interesting thing is the angiogenesis. This also, we can reduce it by preventing and by treating the skin before our procedures. And this is more than interesting when we know the place of angiogenesis in providing pigmentation and melasma. Another article, so interesting. We knew, of course, the importance of skin microbiota to have a balanced skin. Of course, we know that. But the other thing here is that this skin microbiota, this gives a very important part in the healing. So when we have a balanced skin, the commensal bacteria will lead to induction of perforin 2, its antimicrobial protein, and this perforin 2 improve the healing. And all the contrary is done when we have pathogenic bacteria, so it leads to very bad healing. So, two conclusions from these studies. We have to be sure before our procedures that we have a healthy skin, not too dry and not irritated. And other thing is to be sure to control the inflammation during the peeling and after that. So which peeling to advise? Of course, we can do all the superficial peeling, but I advise more the TCA plus phenol and other combination, but we have to be aware about inflammation and really to control this. So some results. Here we can see the improvement of pigmentation and brightness and the pore size. We can see here, we can see pigmentation, of course, improvement and not total disappearance. It's very hard. Other results in a high-level skin type, we see that we can have some results even in this part. Other ones, I would like just to inform you about this redness. Please. Just this redness, we have to be aware about this redness. We have to calm down this inflammation in order not to worsen the situation. Pigmentation also is here, and other pigmentation post electrocoagulation, and we see that we have improvement, and also on the pore size here, and other pigmentation post-acne, and even in the back, we can have with some, of course, we have to be aware about body treatment, and dark circles in Moroccan and Mediterranean part, we have to treat this also. So my top recommendation for safe and efficient peelings, to start the pigmenting treatment 10 days before. I mean 7 minutes from I have my from my okay. So 10 days before the peeling, we have to start the pigmenting treatment to calm down these cells and to continue this for 2 or 3 months after. We have to calm and hydrate the skin, so all inflammation has to be treated before. We have to have good skin hydrated and to avoid all hot environment, hammam and all others, to be aware about herpes because we have a high prevalence, and it's something very difficult to diagnose after peeling, and it can worsen the results, as we can see here. We have to do very gentle application in order, very gentle application in order to have the result and not to have a lot of blanching, and even here to treat the dark circles, we can go under the eyelid. Here the blanching we have to obtain not more than this. Other thing is to manage the post-procedural inflammation with local steroid to start just after the procedure and some healing topics. Of course, sunshine eviction is more than recommended. And lastly, we know that traditional clothes had some advantages, but of course we are not here, and we have to deal with all the changement of our social way to do, and we have to do our procedure with the most safe way. Thank you for your attention.
Thank you so much. Are there any questions for our speaker? No?
And more than welcome for our next Congress in Tangier. Very lovely destination and very lovely program.
Where's that?
Tangier,
Tangier.
in the north of Morocco.
Yeah, I know. I didn't hear. So amazing destination.
Thank
for
you so
sure.
much.
Good luck.